For South by Southwest Day 2, my session 2 was on psychedelics, and I went to the future of psychedelics, drug development, and policy reform with MDMA revolution on both the healing side of it and the controversy that it poses. So before today, I had always associated MDMA with a negative connotation. To challenge this perspective, I wanted to sit in on one of these psychedelic sessions just to gain more knowledge for myself and see if there was something I was missing out on by not having a ton of information on this industry. And I also was really surprised to find out that MDMA is used recreationally, but the reason for this session is how it can be incorporated into therapy and help those with PTSD. As I said, my knowledge on this subject beforehand was very limited in this regard, and I had always thought of MDA as a scary street drug that can cause extreme psychological harm, and I was curious to see how not only they took this in a effect to the medical industry, but also to those in everyday life. So to dive in a little bit just on the session and give some background before my perspective, MDMA is supposed to connect to therapy, and the results last longer. So this was not of interest to pharmaceutical companies. It's actually on the flip side, which I thought was really interesting. In order to promote MDMA and use it for therapy sessions, their main target market are veterans who have been diagnosed with PTSD or women who have experienced sexual assault or domestic violence. Now, beforehand, they did MDMA in assisted trials, and they were either prolonged exposure or a cognitive exposure. However, based on these clinical trials, the dropout rate for the trials was exceptionally high, as over half of their participants would drop out based on MDMA with assisted therapy. Now, there was a certain trauma to it as they were having to relive these experiences, which ultimately caused the dropout within this study. Now, MAPS, which is Multidisciplinary Association for Psychedelic Studies, which is who spoke today, they have changed this narrative as the most recent association of psychedelic studies with MDMA in clinical trials with therapy. They have had only a dropout rate of 2%, which in this trial conducted in 2018, and the follow-up notes on it were published in 2021 as a way to have therapy. So to kind of shift into that, they have tried to maximize these therapeutic outcomes by distributing and giving MDMA in a safe environment. So the sessions that they do are 9 integrated sessions that are each 1 month apart. And what they do is they do therapy with MDMA, and then they do therapy with a placebo effect to see the difference there and if they can start to wean off of it in that regard. But over those 9 weeks, they actually start to dose even higher, getting up to from 40 milligrams to 120 milligrams of MDMA, which is about triple the amount. So I thought that was crazy. In addition to that, the post results of this, so 2 months post results after a 9-month session being 1 month apart, they showed that 67% of these participants no longer had PTSD diagnosis, meaning that in theory this should be working. So that was the study and what was done on it to have that healing based on these therapy sessions. Now, in my own perspective, this session really changed my view, and especially MAP speaking specifically, because I do feel like they're trying to get to the root of the problem and then regulate it correctly. They are trying to attack PTSD and those who have it head on. What was really interesting is they portrayed it as we have a fractured view as Americans on how this is polarized. So how do we bring out the healing potential of psychedelics instead of criminalizing it? Which I don't know the answer to. It just kind of sparked my mind, because if we are going to have this reform, how is this going to work legally? And another interesting viewpoint is, depending on how the election goes, it may change how fast the MDMA therapy is pushed through. Right now, they predict that the therapy will be pushed through in August of 2024. And currently, MAPS has had over $145 million raised from research. And so they're just now finally waiting on the FDA approval. But there are other factors, like I said, those like economical or political factors that might either enhance or prohibit that getting pushed through. Um, Overall, like drug policy reform not only affects technology, scientific studies, the medicine field, legal realizations, and nonetheless everyday life. I would say it affects the consumer the most. Can we really be recommending taking 120 milligrams of MDMA for trauma? I think it's hard to believe. Now, the session also talked about having that bias there. I do not have the same trauma as these candidates, and I have never done this drug. So my perspective is a bit misconstrued and biased on the opposing side here, which I also recognize. As someone who was just genuinely curious about this session, I do see the benefits as they highlighted them, and they had a super intricate course of action that outlined the amount of milligrams, the symptoms one experienced, how many people thought that they had the placebo compared to the actual drug. So their findings were quite intricate in this regard. But as this affects people in the industries, I am curious to see what this is going to look like on a longer term scale. Also, the session did not touch on a ton of the negatives of this treatment. Like I said, they touched on symptoms and the course of action, but I'm curious if there are more negative effects than there were positive that were almost hidden in this regard. And cynically, I do wonder how we steer away from addiction, in this regard. Like, if we are going to implement this and legalize it, how is it not used recreationally, or how do we not have consumers trying to purposely get it or having PTSD symptoms or trying to get that diagnosis in order to be able to use it. So I think it just poses a lot of different questions in that regard. I think it's a multifaceted effects on a side. So I think MDA has multifaceted effects on society overall, ranging from anything from crime rates to public health to economic development. And like I said, my biggest takeaway here is I wonder how it's going to turn out on a long-term, long-scale effect. But overall, a really interesting session to attend and stretched my mind in that regard, because I would have never gone to something like this before. So just a little bit more knowledge on the overall subject in this regard.